Breast milk or formula will provide all of your baby's nutrition for the first 3 months. Doctors advise waiting until your baby is around 6 months old before starting solid foods. Some babies may be ready for solids sooner than 6 months, but you should wait at least 4 months. Feeding will change as your baby grows. Babies will begin to drink more milk during each feeding, reducing the need for frequent feedings and allowing them to sleep longer at night. During growth spurts, your baby's appetite will increase. Continue to feed based on demand, increasing the number of feedings as necessary. As the weeks pass, your baby will become more alert, cooing and smiling. As a result, you and your baby will have more interaction during feedings. The following are just guidelines. Your baby may be hungry more or less than this. That is why it is critical to monitor your baby's hunger and fullness cues. When a baby is full, he or she will slow down, stop, or turn away from the breast or bottle. Most newborns nurse every 2 to 3 hours, counting from the beginning of each nursing session. That adds up to around 8 to 12 feedings a day. As babies grow older, they will begin to breastfeed less frequently and sleep for longer periods of time at night. Your baby is most likely eating enough if he or she appears alert, is content and active, is steadily gaining weight and growing, feeds 6 to 8 times per day, is frequently wetting and soiling diapers. Babies might not be eating enough if they don't appear satisfied, cry constantly, are irritable even after feeding, are not wetting diapers frequently. You may notice that your child wants to feed more frequently during growth spurts. This frequent nursing signals the body to produce more milk. Supply and demand will be in balance within a few days. Since formula digests more slowly than breast milk, your baby may require fewer feedings than a breastfed infant. As babies grow, they can drink more at each feeding and can go longer periods without drinking. You will also notice that your baby is sleeping longer at night. During the 2nd month, infants may consume 4 to 5 ounces per feeding. By the end of 3 months, your baby may require an extra ounce at each feeding. It is easy to overfeed a baby when using a bottle because it is easier to drink from a bottle than from the breast. Make sure the hole on the bottle's nipple is the right size. In the case of combined feeding, you can modify the basic breastfeeding and formula feeding guidelines based on your baby's age. Paying attention to his hunger and fullness cues can also help you determine the proper pattern. If you're still unsure about the amounts, consult your baby's pediatrician. It can be difficult to determine how much milk to give your baby. But rest assured, your child is usually good at getting what she needs, so follow her lead while keeping the general guidelines in mind. You'll quickly settle into a routine and become a baby feeding pro. That's all in this video. We'll meet you in my next video with more exciting content. Meanwhile, do check out our other videos. Happy parenting!